Derek O'Brien, this 21-day lockdown, it has had an economic fallout, and clearly there's had to be some recalibration for phase 2 of the extension. It could not be the way it was over the past 3 weeks, but the government's plan now of these 3 zones in the country, is that, according to you, logical, practical, feasible? Will it work on the ground?
I think let it be made very, very clear that overall there are different kinds of lockdowns, and the way Mamata Banerjee, this is not about phase 1 and phase 2, phase 3 of lockdown. No, we don't believe in that. The thinking of the Mamata Banerjee government has been, and I'm not going into the why it got delayed, why the centre delayed, let's not go there today, since it started. Mamata Banerjee's view on this, she's a grassroots leader. So she's taken a very humane approach from the beginning. So let me give it to you in practical terms. What does this mean in Bengal? You see, there's a drill lockdown which happened, which was the first 14-hour lockdown, which the Prime Minister announced with 4 days notice. Then a lockdown was lockdown, which could be a lockdown or a total lockdown. Yep. Bengal never went that route. We've been in some, what I would call a calibrated lockdown. If you don't like that term, you could call it a nuanced lockdown or a humane lockdown. What do I mean by that? You can still get a taxi in Calcutta if you call a particular number and show your documents. Vegetable markets are open in Calcutta. Everyone's following social distancing. When I say everyone, it cannot be 100%, and maybe 99% we are getting to 100%. The mithai ka dukan is open in the afternoon for 4 hours. Why? Because otherwise thousands of liters of milk will get wasted. Okay, these kind of the BD workers are still going around with their doing their business in Murshidabad. The tea garden workers, not all of them, 25% of tea garden workers are still plucking and sorting tea. So we haven't opted, the state government of Bengal has not opted for a complete lockdown. So we feel it will be less adjustment for us to make from day after tomorrow, because we've already been in that mode. I think, so from that point of view, there are different states who've handled it differently. We don't have,
and that will be of relief. The people of the state will be relieved to hear that. But Derek, you know, this is a catch-22 situation. How do you fight the virus without the economy falling ill? What does this mean in terms of the cases coming out of West Bengal? Have we seen a rise over the last 3 weeks then because of your nuanced, calibrated approach? Because as far as I know, and correct me if I'm wrong, I think West Bengal's cases, the figures are around 130, but there's also been criticism that not enough testing is being done in the state of West Bengal, as similarly for other states.
I just got the figures today, just now, like 15 minutes ago. Where are you with 130? No. We've had a total here, they've just come. There's 7 deaths. There are 7 deaths.
No, 130 in that range total cases, but I'm glad you have the latest figures.
Yeah. Latest. Every day it's going, every day we're giving the latest, but we're looking at it a little differently. One is look at the figures, look at the action on the ground. I think there's some more macro decisions which this West Bengal government has taken. Firstly, I think we're the only state, we have a clear organizational structure. I'm not saying other states don't have, they may have, but I can talk about my state. The chief minister is getting, besides all the bureaucrats, the chiefs, the principal secretaries who are inputting upwards, there are 8 such groups, task force. There is a global advisory board of international experts. They had their first meeting day before yesterday. Let me tell you, I wasn't a party to the meeting, but I've spoken to 2 of them. Those meetings lasted for 9 or 10 hours. Great inputs from the global advisory board and on the local state doctors and health experts. They are inputting to the chief minister. So the organizational structure is in place. We got the humanitarian part out right up in the beginning. What did we do for that? We said no one can go hungry. So what
Derek,
is happening?
My question is simply, while it's absolutely important, one cannot not keep a humanitarian approach in mind. What does this mean for testing? Is there a risk then that the number of cases could rise?
Okay, let me finish my point on humanitarian, because I'm going to immediately after answer your question on testing. Humanitarian, 8 crore people in Bengal will not starve because rations were assured 2 weeks ago. And by the way, there are 2 lakh immigrant laborers, I call them my guest workers, who are in Bengal, 780 camps, they're all being fed. Not only Bengal is doing it, other states are also taking care of migrant labor, and we appreciate that. Now to answer your question on testing, listen, there are a lot of things, Ms. Jacob, which are doing very, very well in Bengal. Testing, yes. Now that we have got 25,000 more kits, we didn't get the kits. I can tell you with confidence that the numbers will go up. But I think in this, what has been very positive is that we've managed to set up an interesting model where we don't want patients or suspects to travel to Kolkata. We don't want that. That's why we've set up 2 to 3 COVID hospitals in every district. Otherwise, this traveling to the big city is not going to work. And I gave, I think day before yesterday on your program, there were some problems with the PPE kits coming in from, we asked for 1 lakh, we got 3,000. Now we have more than 1,50,000, 2 lakh PPE kits. So things are going well, but in no state, Bengal or otherwise, this is no time for complacency. I only want to make one request.
No time for complacency, and as the Bengal Chief Minister said, no time for politics, as you've repeated today. Still, she has raised, pointed out the discrepancy of the Prime Minister Cares funds being considered as CSR funds, but not the Chief Minister's funds. Now, this weekend, the centre has clarified. They're saying that CM funds or state relief funds are not included in Schedule 7 of the Companies Act 2013, right? So that's the logic they're giving. So they're saying it's the law, it's not an underhand move, which is what the opposition and many critics are attributing it as. Your response?
Listen, just lagaing a few press conferences without knowing how legislation works, how parliament works. Now, I'm glad you've asked me this question. And this act came in 2013. 2017 to now, important number, it's a few hundred amendments which have been made to this act. Because Mamta Di advised me in 2018, I don't want the credit, she should take the credit. She at that time spotted it and she told me, Derek, you must move a private member's bill, which I did in 2018. And what does that private member's bill say? It says, you sure, CSR can go to the Prime Minister's fund, but in a federal structure, it also needs to go to the Chief Minister's fund. That is in my private member's bill. If the government is making an excuse, leave the private member's bill, that's gone, I'm still waiting. If the government is making an excuse, since they are the masters of ordinances, let me give you a statistic. This government, and I'm not doing any politics on COVID, please. I'm not breaking that rule of mine. I promise not to. But this is on legislation. This government has a track record for every 10 bills they pass, 4 are ordinances. Earlier governments, that number was 1.8 to 2 ordinances for every 10 bills passed. If they are serious about doing this, rise above.
Okay, fine. Point made, point accepted. But Derek, one logical fallout, many are pointing out, would be that if the Chief Minister's relief funds are included, CSR money, they say, will not flow outside of the industrial states. That is Maharashtra, Gujarat, Andhra Pradesh, etc. They will consume over 50% of these CSR funds, and non-industrial states like Bihar, Bengal and Orissa, they will remain high and dry. Are you prepared for that?
Very good. I'm so happy you asked me this question on a Sunday evening. I've even forgotten today is Easter Sunday, but that's another story.
Well, you're not alone in that.
No, it's good. I think this, on another subject, this worship has become private, and I think that's
and
good.
It should stay that way.
Program on that. Yeah, worship
Work
has become
from home
private.
And pray from home. All right, quickly, let's answer that last question. Derek, we have to move on.
No, I'm sorry, I'm digressing. Seriously. Let's take my state. You owe us, Centre owes West Bengal 36,000 crores plus old debt plus 25,000. That is a total of 61,000 crores. 2,400 is included of the GST debt. 11,800 is devolution of states. You first give, let the centre first give the state the first 36,000 crores, which is backlog. Then we'll come to all this. Then you've given 1% of your GDP, which is 1,70,000 crores. No, my Chief Minister yesterday told the Prime Minister at the meeting that please make that GDP percentage 5 to 6%, which is 8 lakh crores. Number 3, put the money to the daily wage workers. But before we do anything, we don't need to bring ordinance now for PM relief fund. That can wait also. I'm okay with that waiting. But before that, please pay. We're not begging here. The Chief Ministers are not begging. What is owed to us, Baba? Pay us.
All right. All right. Thank you, Derek OBrien, for joining us. Especially, yes, it is Easter Sunday. Thank you especially for joining us tonight.